Okay, let's get started. So my name is Tracy, and welcome to our Zen City Local Government Leadership webinar series to discuss how cities are balancing some of the serious challenges they are facing today. I'm a customer success manager here at Zen City, and I'm honored to be here today with Amanda Daflos, the Chief Innovation Officer for the City of Los Angeles, and Derrick Brownlee, the Managing Deputy Chief Information Officer for the City of Chicago. Feel free to ask questions throughout the webinar using the Q&A box. We'll get to them at the end, and feel free to ask them throughout. Thank you so much for joining us. I know that most of you are city leaders yourself who are on the front lines of meeting your citizens' needs during these extraordinary times. And we thank you for taking the time out of your busy day to be here with us. And I'm really excited to hear from both Amanda and Derrick, as I know how much they have been on the front lines, just like you, about how they've been using data and technology to better serve their residents during this challenging time. So today we'll be hearing from both of them on a number of different topics. But first, let me give a brief introduction of Zen City. Zen City is a software and services solution for local government agencies to collect and analyze resident feedback. Today, we work with over 140 local governments across 4 different countries, the vast majority of which are the US and Canada. We use artificial intelligence and advanced algorithms to analyze high volumes of resident discourse in real time from a multitude of public, social media, and news sources. This allows local governments to quickly identify residents' top concerns, understand resident sentiment, and inform senior decision makers. We know that local government officials have some of the most difficult jobs. You are on the front lines every day, serving your communities. Your challenges also come with the needs to continually prioritize while resources are limited. So you also need input from your residents in real time to make these decisions. What we at Zen City are saying is that local governments don't need to work that hard to find the feedback, because a lot of it is already out there. People are posting, tweeting, and commenting about the issues that you care about. And with that, let's get started with our agenda. So we're going to start with you, Amanda. And what I'd love to hear from you first and foremost is a little bit more about your job as the Chief Innovation Officer in Mayor Garcetti's office, and especially how that role has shifted a bit during the challenging times we're facing recently.
Great. Well, Tracy, thank you so much for having me and for having the City of Los Angeles and for profiling all the work we're doing. And it is, of course, an honor, Derrick, to be here with you as well. And then for everybody on the call, thanks so much for caring about anything we're doing in LA. We're always excited to share and equally excited to learn from our colleagues around the world. In my role, essentially I've been with the City of Los Angeles with Mayor Garcetti since 2015. My role initially was to set up the innovation space in our office with a grant from Bloomberg Philanthropies by setting up an innovation team. And now I sit in Mayor Garcetti's executive office with the opportunity to do, basically, as I like to call it, a little bit of everything. So we touch technology, we touch program, we touch making services more efficient. We do everything with data and with design and project management in mind. So anything we touch, we sort of bring that suite of interdisciplinary skills to the forefront. As I mentioned, we've done a little bit of everything. So we build websites, we redesign programs, we create new programs. And in the world of COVID, my role has become acutely data and research, and helping the city really shape our knowledge around COVID, and then also shape the solutions that we're bringing to the table, with data and research in mind. So again, it has looked a little bit like everything from setting up, a partnership with our county public health to deploy contact tracers, to briefing the mayor every single day with data that you can get online yourselves about our scenario here in LA.
Thank you. And that sounds like such an interesting job. And I'd have to say I'm pretty jealous. So when we were talking before this, prepping for this webinar, you told me a little bit about how LA became the first city in the US to be promoting mask wearing during COVID-19. And I'd love for you to share with our audience today about how you came to that decision and how you're using data from a global aspect.
Sure, yeah, happy to do that. So back in March, well, actually, like many of the folks on the call, I'm sure you, like me, were following COVID starting in January. And I started getting really nervous somewhere around February and following a lot of what was being done in Asia to prevent and even offset COVID. Yeah, and one of the things, as someone who's traveled and actually lived in Asia myself a lot over my lifetime, masks are part of the culture there. And it became really clear to me that it was much more acceptable to wear a mask in a time of COVID. And that the research was bearing out that masks were potentially one reason why they were able to offset transmission as quickly in some places as they were in places in Asia. And early on, as many people I'm sure know, particularly people who are working on what are called NPI, non-pharmaceutical interventions, there wasn't a lot of information. There weren't a lot of studies just because COVID was brand new. It's a novel virus. But from the data that was out there, it certainly looked like countries that were early on in their outbreak were using masks, didn't have as much resistance as we at least see now. And that there was reason to believe. And so I did a lot of homework. I prepared, kind of our office to begin thinking about it. And in late March, early April, I believe, we sort of went counter to even our own public health department here in Los Angeles and issued a mask advisory. And here in LA, we did it very, very early. I would say that we haven't had some of the things that you might see happening in other counties. By the way, our county soon followed, the CDC followed, not that long after that. And counties all around California and around the country started issuing mask guidance. And again, that was all based on research done about what's happening in Asia with COVID and also previous viruses, right? Because by the way, this isn't the first virus that's ever hit us. It's not the first time people have used masks to prevent anything. My theory was, well, if this is respiratory borne, there's lots of other things that have been respiratory borne. What is the likelihood that it's going to follow a pattern just like that? And it turns out that masks now are, issued, and I believe today will be issued, a little bit more strict in California as a state. So point is, data can help us, research can help us, looking outside of ourselves can help us, looking at history can help us. And becoming experts in this case, in a disease like COVID, though novel and changing every day, has been my approach to anything new that we've introduced here in Los Angeles.
Yeah, that's great. I think that's an awesome story. And something else I know personally you've been using throughout this time period is Zen City. And when we talked before, you talked about how you guys have really you've really integrated it into your process on a day-to-day basis. And I'd love to share with our listeners a little bit more about how you're integrating resident feedback into this process that you're, giving data reports every day.
Sure, yeah, happy to talk about that. Tracy, as you know, we'd been talking for quite some time, maybe even a year and a half with you guys. I was keenly interested in bringing Zen City to the city of Los Angeles. We were moving forward, not quickly enough. And it turns out COVID helped me move this very quickly in Los Angeles, actually within a day. So in early March, we actually began full use of the tool. And my idea and my desire was to be able to use Zen City to monitor, sort of knowing what we were going to likely go through in a pandemic, and being able to monitor what people were saying about the pandemic, and also potentially being able to monitor, which will now, I think, become even more important, things like outbreaks, things like bad actors, things like good actors. This is the kind of tool that can really help us, monitor things in a pandemic that government can do something about. And that we can do something about in the ways of education, which we've done a lot of here in LA. If we hear people talking about confusion about something, we quickly use our opportunity with our mayor to clarify that information, whether it's through Twitter or through a briefing or through some other channel. So my use of ZenCity and our city's now use of ZenCity has been data analysis and then empowering our communications team to have keen messages that are timely and sharp and address the actual things that are being discussed online. So we've used it for COVID. We were using it throughout what many cities like us may have encountered, which is protests for George Floyd. And so as people wanted to learn more or know more, ZenCity was a really important tool for us to be able to just understand what people were feeling, confused about, and opportunities for education and clarification.
Yeah, so I think we definitely have some examples of that. And going back to masks, I think that's definitely one of them where we've been, following how people are talking about masks, misconceptions about masks. So how can you say, specifically how you've responded to the resident feedback on masks throughout this process?
Sure. Yeah. Well, early on, the question was, are masks required? Are they required all the time? What if I'm running? What if I'm on a trail? What if I'm outside? What if I'm inside? While we tried to be as explicit as we could be, I think there was just general confusion, particularly around athletics and being, outside in the fresh air. If I'm running, do I have to wear a mask? And it helped us just understand that, we needed to basically say, which is what we say now, masks are required at all times in public. And if you're going to encounter another human, that's when it's required. If you're out in the middle of the woods by yourself, you don't have to worry. But really the thing is, you're trying to essentially not share your air. And when there are other humans, that's when it's acutely important. But that confusion, particularly around, indoor and outdoor, and then this question of like, well, what if I'm running? Basically the message is if you're running in the woods by yourself, cool, no mask required. But if there's a chance that Tracy or Derrick may pass you, that's when you need to be sure that you have a mask on. And I think we've done a pretty good job in LA. We believe we have pretty good compliance in the city. Relative to places where maybe there's been more confusion or more contention around masks. Some of that is born out of other messages that are happening at the national level, of course, and confusion when lots of different jurisdictions say different things. That's a big part of it that we can't control. But what we can control is what Angelenos are saying, what they like, what they're confused about, and then using our opportunity to be sure that both our law is clear and our message is clear.
Yeah, that's great. And I love this use case because, I have to say before COVID, I can't point to many, I think our data is so great and so impactful in so many ways, but I couldn't point to an area where I felt like it was really saving lives. And since COVID started and I see these, misconceptions about masks that we're bringing to attention that, you can then go and communicate. I really feel like this is data that can actually save lives. And that's really meaningful to me. The next thing that you brought up earlier was the nationwide protests that everyone was facing and really in LA very strongly. So what kind of listening to your residents were you doing in this case? And I know you also have a background in police work that has also influenced how you've been working on this. So I'd love to hear you share about that.
Sure. Yeah. Like many cities, we were sort of encountering both of these things at the same time. And I think one of the things that was one really important thing, I think, was looking at, all of our social, how many people were talking about COVID and the speed with which it shifted to, matters of protests, matters of defunding the police, George Floyd, Black Lives Matter. And really just simply being able to understand where people's heads were at, for lack of better words, and where their hearts were at. And I think that was that in itself, just being able to watch that shift. And then also, even as cases began to rise here in California, very unfortunately, we are now one of the new hotspots, probably on the planet, but definitely in the US, and certainly in California. Protests were really important to people. And we saw that in social. Even as cases were rising, this continued to be very important, and understandably. And so I think that that message to our leaders that the risk is pandemic. That risk is not enough to cancel out the desire and goal of people to make their voices heard. And so I think we were really clear about that, and being able to understand that simply because, like I said, there was just less attention being paid on a pandemic, even at a time when the news was saying, we have more and more cases. Are protests a risk? I think we did a pretty good job. I think even protesters here did a really good job of wearing masks and trying to stay safe. So we messaged that, stay safe while you're protesting, was I think a message that was sent by our public health officials and our local politicians. Now the question is, of course, here we're now, we're still experiencing protests in Los Angeles, by the way, but our numbers are skyrocketing. And so now the question, of course, becomes on social, was it the protests? Is it because we were reopening? Like, what is it exactly? And science is telling us that it's probably a mix of a lot of things, because it all happened at the same time. So, but at the end of the day, I think we've been watching that. We've also been watching the messages that are important to people when it comes for calls to action of government. Not just protest news, but what is the call to action, and how should local leaders actually respond? To me, that's really important in the space of policing. Like, what are the things that we should do? Because it isn't enough to just listen and do nothing.
Yeah, definitely. So I mean, I really loved hearing from you about just the way that you've been integrating data of different types into your day-to-day process. And I personally, from working with you and your staff, have been really impressed by that process, that it's not something that I see amongst all cities, and it's really impressive. So thank you so much, Amanda. And now I'd love to move on to the city of Chicago and Derrick, and hear a little bit more about, we heard a lot about data from Amanda, and we're going to hear a little bit more about technology from Derrick and how that's been helping throughout COVID and beyond. So Derrick, I'll pose the same question to you. If you'd like to introduce a little bit about what you do on your day-to-day, and also how that has changed during COVID-19.
So Tracy, thank you very much. I hope you can hear me.
Yes, we can hear you.
Thank you very much. Amanda, it's a privilege of joining you on this session. So thank you very much. And we definitely appreciate the invitation. So on behalf of the city of Chicago, a big thank you from the Windy City. A big part of my job as the managing deputy commissioner, or information officer, I should say, is finding various technologies that will allow us to grow and scale in such a way that in times of transformation, such as we're going through right now, we're able to pivot and turn in such a way that doesn't require us to be in that procurement challenge, because we've mobilized our enterprise applications in such a way that we're using as close to 100% of their functionality, and reducing what we call shadow systems that are often very difficult to integrate with enterprise applications. In this way, we have a centralized platform. So I'm responsible for many of the enterprise applications that range from N4, which is licenses, inspections, and permitting, Salesforce 311, Health and Human Services platforms, enterprise applications, Oracle, and Microsoft SharePoint. So my job is really to kind of help focus on creating that roadmap so that we're getting, like I said, full functionality out of our systems, and to keep identifying innovative solutions like Zen City. Zen City was very helpful in getting us to really pivot into the world of AI and really find creative ways to engage with citizens analytics, I'm going to call it that. for some reason, some residents feel more comfortable releasing their thoughts and opinions in the social media world. And that's a good thing. What we had to do was like, well, how do you harness that information back in such a way that is constructive to give back to the mayor's office, but also the departments that are doing, really crucial, critical services throughout the day. How do constituents feel about their work? And so when we see some of this great data, what you also see is the level of appreciation that a lot of residents have for government employees. And you don't often get to hear that story. So it's not always the bad story. It's also the great stories. And that way you get this information back to the departments in a constructive way that allows them to share it with their staff and say, you know what, there are people that appreciate what you're doing. And that's, pretty key to us.
Thank you so much, Derrick. I really appreciate that. And I wholeheartedly agree. It's something I always say to the city leaders that I work with, that, most of the time you're just used to hearing the complaints, and something that one of our algorithms does is show sentiment, positive, negative, and neutral. And that way you get to see the times that people are talking about you positively and they're just not talking to you. So that's something I wholeheartedly agree with. Before I continue, I do just want to remind everyone that you have the Q&A option if you want to ask any questions, and we'll get to them at the end. But before we jump into Zen City, I wanted to talk about some of the other technologies and projects that you've been implementing during COVID-19 to kind of get the city on track with helping residents throughout this process. So I know that there's been a new app, you've been working on contact tracing, and you also mentioned updating 311. So I'd love to hear a little bit more about those.
Absolutely, thank you very much. So yes, we worked on a project that allowed us to create what we call a COVID coach app. As everyone is aware of, there's multiple sources of information, and if you're a resident or a constituent trying to figure out where to go and what's right, that's very frustrating. The COVID app, the Shy COVID app, allowed us to inform our constituents to understand what were the early symptoms that would allow them to help them to identify where they were at in this process. And that has evolved, obviously, as we've moved forward and learned more about the virus. But it was a way for us to harness informing the residents of symptoms, alerting them to where testing sites were. That was another big one. And then it's the vaccination registration process. It's an app that you could just download. It's really simple. And ultimately, that was built into connect to the whole contact tracing. So another project we did with Google and MTX was to come up with a Power BI dashboard that would allow us to document in a real-time manner the confirmed cases, how many people we've tested, how many deaths have occurred. And it was able to break that information down by ethnicity, but also by zip code. So you could look in your area and see what was transpiring as well. Another adjustment that we made was to the Salesforce CRM system, 311. We created additional service requests for constituents to find out if, in some cases, businesses weren't necessarily being compliant with what the governor's orders were. And so I'm specifically talking about employees and employees' rights in this whole situation. And so we created a service request that allowed them to call into us, validate, submit a request. We would then be able to route that request over to Business Affairs and Consumer Protection. And then they could do the follow-up to determine whether or not that business was being compliant. We also created a service request for food assistance, emergency food assistance. The vulnerable population, the seniors in particular, and those with underlying health issues were probably most exposed to not being able and just to go grocery shopping. It was those little survival things that we had to build in. So we built a service request that allowed and partnered with one of our city colleges as well to do this, was to create that work order management system on the 301 platform. And then we coordinated with local non-for-profits who would help distribute foods to those individuals or to those families. So those are some of the things that we did to pivot, and the 311 is probably one of our most heavily used applications throughout the city. So it became the main source of having constituents. If you didn't know where else to go, you know you can call the city's 301 system and we're going to plug you into something. So those are the small changes that we made, as well as we also had to be cognizant of our own staff, our City of Chicago staff. And we moved into a telework mode, and that was very different for a whole lot of reasons. But we also had to make sure that we were getting information, relevant information, real-time information to our employees, because sometimes we forget, they're part of the fabric too, and they're citizens and residents as well. So.
Yeah, this is so impressive to me, just how agile you guys were in getting all of this, tech up and running so quickly to transform the city when you really needed it in so many different aspects. So I just thought that was really impressive. And then I also wanted to talk a little bit about how you were using Zencity during this time. I know that the public health department has always been one of our biggest users in the city of Chicago, and they actually joined on for a different purpose, which we'll get to in a minute, but they found this information pretty useful during COVID. So I'd love to hear you talk a little bit about how they were using it and how the city was using it to combat misinformation, answering questions. And
yeah, that's a really good question. The whole mask conversation is an interesting one. It's turned into a different type of purpose, and it really is simply a public health issue. And it's turned into a political football for some people. But with that being said, the purpose behind this was to understand what the sentiment was in the public and identify, different outreach methods on how you could more effectively inform residents of the benefits of how this was going to help. Not just them, but the public will, and all that leads into the whole reopening of the economy. People were struggling, not being able to work, but there has to be a safe and effective way in how you approach this. So the mask was really used to, what communities do we really need to reach out to more? Is the language translating in such a way that people are understanding it? And so that's how the CDPH, and I want to say the Chicago Department of Public Health was the leader, absolutely, as they should have been, in helping us coordinate or move some of this IT in a very different direction. So kudos to them. But like I said, it really came down to effective outreach strategies that we needed to identify to better inform the community. I'd like to say in a lot of different ways we're doing a really good job, but I'm not one to get too high or get too low right now. So I just like to stay even keel with this. But we found out that the general consensus was that the vast majority of the individuals were supportive and they were compliant. So that's a good thing.
Yeah, and that's just it. I know that everyone's still in this, right? You're not past this. You're not at a point where you can say we did a good job, we did a bad job. We're still in this. but being able to monitor it on a day-to-day and get that kind of indication of how you're doing is I think so important. And then I did want to talk a little bit about how we started our relationship together. And this touches on how we were working with the Chicago Department of Public Health before COVID. And also now that restaurants are opening back up, I'm sure it's going to become relevant, but we started this project called Foodborne Chicago together that's been a labor of love for both of us. So I'd love to hear you talk about that.
So this is one of my favorite success stories of 2020. As I've been trying to look at different ways to automate our 311 system and move in the area of prevention, we were able to partner with Zen City and identify a couple of service requests that we would like to extract social media data and connect that to the 311 system to create an actual service request without anyone actually having to have to call us. And what we've learned is that a lot of people will go on social media and indicate that they thought they got food poisoning at ABC restaurant. And we were able to tie in that information in such a way that via AI, if we began to see a pattern that was developing for that particular restaurant, we were able to create a service request to send a food inspector out to that restaurant, out to that facility to do an inspection. And it's a really good way to get ahead of the curve, because if there was something that was going on that is food related, foodborne related, we're stopping that many other more individuals from actually, getting food poisoning, for instance. So we were really excited to be able to do that. And we have a vetting system that's in place. So we're just not taking every social media response and just simply creating a service request. There's a vetting process. There's a threshold that we have established that allows the department to hit the submit button that creates the actual service request. And we're seeing some really good data about this. And it allows the department to also communicate back to those individuals and say, hey, you know what? We hear you. We're sending somebody out. Thank you for letting us know. That is a different level of customer service. And that's the type of customer service area that we would like, that we're trying to move towards. So our intentions with Zen City is to continue to identify those relevant service requests where we can extract that data and create an automated way of creating a service request without no one even having to call. Again, it's being in that prevention mode, being in that preventative style of attack. So thank you, Tracy, for hanging in there with us and getting this project off the ground.
Yeah, no, this was exciting for us too. Obviously, this isn't the main thing that Zen City does as a company, and it was something very cool and interesting for us to have a partner like you to develop together. And it's really exciting that now restaurants are opening back up so we can start identifying the problems with them again.
And the interesting thing about that is that the mayor's office has just been incredible leaders and has been very gracious with creative ideas. And one of the things that we were able to do was create an online permit process for restaurants to open up on the sidewalks. So that was to deal with the phase 1 and phase 2 and the phase 3 process of how many people can be inside of the restaurant. And within less than like 96 hours, we were able to produce this online permit process that allowed you to submit, hey, I want to open up more, I want to use the sidewalks to comply with social distancing. So as Amanda knows, this is an evolving process that we're going through. We get new and creative requests every 5 minutes. So we've not lacked for things to do around here.
Oh, I'm sure not. So thank you so much, Derrick. That was super interesting. And now I'm just going to open this up for questions. I see that we already have one, and please go ahead and ask more. You can use the Q&A. So the first question we have, I think it's for both of you. So just we can answer one at a time. But as you adjust to ongoing crises, are you adjusting your overall long-term strategic plans as well? How are you managing that? Amanda, do you want to take that one first?
Sure. I think COVID probably in a lot of cities and states is, and maybe even businesses, is mandating our attention 100%, at least in our case here. I think, our strategic plans have evolved by necessity, in the sense that, anything we were working on, the nature of what that was has changed. For example, if we're working on things with our homeless community, their whole experience has changed at the moment. So therefore the work that we're doing has changed. But in terms of our long-term strategic plans, yes, it will change. I don't know that I have the answer to what it will change to yet, given that we're in the midst of all of this, but this is a live and moving and evolving situation. So, I was really hopeful we'd be able to revisit all those things, this fall. And so I'm going to remain optimistic that COVID will, recede and give us a bit of a break, but I'm also conscious of the fact that we need our residents to help us make that happen, to give us all the chance to step back and rethink our futures.
Yeah, definitely. And Derrick, how about you? How has this impacted your long-term strategic plans?
Well, ironically enough, we were in the middle or in the process of starting our IT application assessment citywide. And I have 35 departments and 35,000 employees that we deal with. So, but I think the biggest uptick as a change with us is how do we move our IT forward and incorporate our constituents into the development of that process? How do we get more citizen engagement around that? So the other area that I think that has affected us IT wise is the question of telework. We have a number of instances where we are seeing telework has actually been very successful, particularly on the IT side. People are able to get in via VPN. They're still able to make code changes to their applications. They're still able to provide, application, support help. We've used Microsoft Teams to WebEx. And what we're finding is people and businesses in general are going to start looking at, are there any economic benefits to this? And that's going to play a big role into, do you move as a mobile device workforce now? Will PCs become, obsolete, because you want your workforce to be more mobile and you want to be able to work from home? How's that going to affect our cloud environment? Do we start to reduce our virtual servers and move to more cloud-related applications? And so these are all questions that we're starting to ask each other, because however, whatever it looked like yesterday before this happened, I assure you it is not going to look like that how we move forward. It is just not going to happen. The dynamics are just of such that these are significant changes. And our IT is going to have to shift towards more citizen engagement and a mobile workforce. And those are both cost-related things.
Yeah, I definitely, from all the different cities that I work with, have seen a lot of strategic plans kind of thrown out the window. And for a while, everything was just COVID. I am seeing now more so people are getting back to some of the, capital improvement projects that they had planned and the general plans, but it definitely kind of threw everything off course, and the world is very different than what we knew it was before. We're getting another question that I believe is for both of you. As more and more cities and states are experiencing spikes, what are some of the learnings from the initial impact of COVID-19 that you feel you will implement earlier than last time?
I know one of the, I'll jump in here real quick, Amanda. One of the areas of IT that we're looking at right now, and I've been dealing with it all for the last week or so, is scheduling and booking. As we're in a different phase of reopening, employees are going to start to move back into the workforce. We're still trying to be compliant with social distancing. So one of the areas that we're looking at is creating an online scheduling booking component so that we can help the staff and our residents manage how they're accessing certain buildings to get certain services done, or even to make certain payments. That's something that we had not really thought of, historically, but now we're going to have to look at, I can't have a line of people outside of, City Hall, for instance, to line up to get a city sticker. Is there a more effective way on how you can stagger that process? And online scheduling is booking is one of the things that we are closely looking at right now. That's for the safety of our staff, and that's for the safety of our constituents, just like I said, to stay compliant with social distancing. That's a big one for us.
Yeah, that seems really, really important. And Amanda, you guys definitely are seeing that surge now. So what are you looking to implement earlier than or differently than you did kind of in the initial phase?
Well, I think, one of the things that and maybe we didn't have to do this in the first round of COVID here because the scenario was different. But, one of the things that now, excuse me, now that, we are seeing cases, at a shocking rate of, frankly, about 3,000 cases a day here, trying to be smart about outbreaks. And so I don't know how we're going to do that. That's my project for today, frankly. But, trying to be more targeted in what we do so that we, frankly, the best we can avoid shutting everything down, certainly the better. Meaning if there's, 30 restaurants or 30 factories that are out of bounds with infection protocols, and we see that hundreds of people are getting sick from those places, let's shut them down versus the entire restaurant industry. And I think that that's a way that data can be really important because it can save both lives and livelihoods if we can do it in a way that is impactful. And that is reliant, both fortunately and unfortunately, it's reliant now on contact tracing. So I would also advise that if there are cities out there that, your public health departments are questioning whether or not to get, an app or to work with like Citizen, we have not done that. Our county of public health has not done that. We do not have an app here that everybody is using. And I think now would have been a great time to have that. And so I would advise, not everything is a good fit for everyone and not every app is good, by the way. I'm sure like Derrick and others on the line who are in positions like ours, you get probably 5 emails a day from people who have, contact tracing apps. And you have to talk to all of them. But, what I would say is that there are some ones out there that are proven and being used. And so I do think it's worth exploring that. And if there's one lesson, I think that, I expect that folks here will look back on, I imagine that that's going to be one, that there should have been, an app here. We're doing manual contact tracing, so hopefully that will help us. But I would recommend exploring, reputable companies and trying to, earth those out. I'd note that Johns Hopkins has put out an opinion paper on that. So worth looking at that. In terms of, Johns Hopkins, their point of view on, these COVID tracing apps that are using Bluetooth and so forth. So So that's probably one thing I would say.
Yeah, yeah, definitely. So we have another question here that is about prioritizing budget. So we have some smaller cities on the line. You're the second and third largest cities in the United States, and you both received CARES Act funding. So the question we're getting is for smaller cities that are, everyone's facing budgetary problems right now. What tech and procurement advice do you have for smaller cities that are suffering from major budgetary restrictions, and any key tech that you would prioritize during this time?
Just quickly for me, I would just simply say, because even though we're the third largest city, we're budget we're budget tight over here too. I would say, for right now, contact tracing. If you don't have it, get it. It's critical. There's going to be another wave. Let's just be real clear about this. And the behavior is indicating as such, and we've seen it, from other countries that this has occurred. So I think that's key to get that in place, and keep it simple. Stay with SaaSes. Don't go getting servers and virtual machines and all that other stuff. Stay in the world of SaaS. It's going to be cheaper for you. The maintenance and support is generally already built in. And most SaaSes are built in such a way that there's no coding involved. It's just configuration. So it's a much quicker and more efficient way for you to scale up. And don't go in the grocery store and buy everything. Get the basics of what you need and start there and then scale up.
Yeah, I like that. And Amanda, what about you?
I would echo that. I mean, I think this is not going anywhere, despite my own personal wishes and everybody else's personal wishes. We're in a pandemic, and a pandemic costs. It's going to create economic challenges beyond those that even we have now. So, I would just continue to say the contact tracing apps that are reputable and work. And are things that can be done either free or easy. We have not tested the Citizen product, but it's the only one I've encountered so far that's free. It's one of the only ones I've encountered so far that's also already established in terms of being a company that works in cities, and and there are others out there, Apple, Google, established products that can be used in a way that's meaningful for the size of your community. I think the other thing I would say is, as we look to try to get people back to work because of that economy piece, and because we all need to be back at work or sustainable in the jobs we're doing, somewhere along the line of all of this, someone sent me a graphic that I imagine Derrick, you'll appreciate, and several other CIOs on the line will appreciate, which was that nobody with a C in their title has ever been able to do what COVID has been able to do in terms of telework. Overnight, COVID was the only C that was able to actually put us all on telework, particularly in government, a place that, for lots of good reasons and sometimes not so good reasons, resists the idea of telework. So here we are, lots of people are working from home. But I do think that we probably need to be prepared as government to be flexible in this next year. And so apps like the one that Derrick was mentioning around scheduling, helping people be in the office when they can be, because there's a lot of people that want to go back in the office and are most productive. And by the way, also offers services that they need to be in the office for in cities like our cities. Finding ways to enable people to be in the office safely I think are also going to be the next space for both innovation and necessity, which, as we all know, often drives innovation.
Thank you so much. So I think that about covers it. We're not seeing any more questions right now, and we're just about out of time. So I want to thank both of you for joining me today. I know how busy you both are, and this was super interesting. And I love working with both of you and your teams, and I'm so happy that we're able to collaborate during this crucial time. And I'd also love to thank all of our attendees, because I know that you're also busy on the front lines dealing with this situation, and I appreciate you joining and listening today. So thank you so much for joining us, and that concludes our webinar for today.
Thank you very much, Tracy.
Thank you all. Take care.
Thanks, Amanda.
Thanks, Tracy. Thanks, Derek. Thank you.